The Scottish Greens want heroin doled out for free on the NHS, we can reveal. A policy plan to give addicts Class A drugs via prescription is contained in leaked documents. The proposal, slammed as reckless by opponents, is set to be voted on at the party's conference in Edinburgh this weekend. But there is internal discontent over the move under co-leaders Ross Greer and Gillian Mackay. One disgruntled Greens insider told the Scottish Sun, "Our country's record on drug deaths is a national scandal and we obviously need to be doing whatever we can to fix it. Many of us have loved ones with addiction issues or have faced issues ourselves in the past. If they saw some of these ideas, they'd be very concerned." It comes as polling experts say an SNP/Greens coalition is highly likely after next May's Holyrood election. Scottish Conservative drug spokeswoman Annie Wells hit out. This reckless proposal sums up the Greens' warped priorities. They're happy to increase state-sponsored drug taking and exacerbate Scotland's drug death crisis rather than help those with addiction. Instead of fueling their addiction, their MSPs should have voted for the Right to Recovery bill last week. Greens are to debate a proposed drugs policy change and are being urged to back expanding free prescriptions to narcotics. The party last year called for the decriminalisation of drugs, a move which could see the possession and even sale of heroin, cocaine and ecstasy legalised. And they want a nationwide rollout of so-called fix rooms where addicts can legally take Class A's. The party's drug spokeswoman Maggie Chapman said this well-evidenced policy frees up valuable resources to spend on caring and compassionate rehabilitation and recovery. Councillor Alice Armitage, a children's doctor behind the motion, said, "Politicians who think that prohibition works are deluded. The idea that we can arrest our way out of the war on drugs is a complete fantasy."
Choose life. Choose medical heroin on the NHS instead of shooting up in an alleyway. Choose a legalised, regulated drug supply that undercuts organised criminals and puts them out of business. Choose safer streets. Choose individualised, compassionate healthcare, housing and psychological support for people who use drugs. Choose to accept the reality that people have always and will always use drugs. Choose to stop spending tens of billions of pounds of our public money on the moral crusade of prohibition that's been failing for 50 years. Choose the Greens drugs policy. Choose life.